Welcome to the Functional and Integrative Medicine podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Welcome to the podcast. Today, I'm excited to introduce Dr. Deepali Kashyap, a leading functional gynecologist and the founder of Galleria Women's Health in Henderson, Nevada. Board certified and highly regarded in her field, Dr. Kashyap is passionate about helping women navigate menopause, hormone imbalances, infertility, and overall sexual health through a blend of traditional and functional medicine. Challenging the idea that women must accept fatigue, discomfort as part of aging, Dr. Kashyap works closely with her patients to uncover the root causes of hormone imbalances and develop personalized year-long treatment plans. Her approach focuses on restoring energy, improving well-being, and optimizing health through bioidentical hormone replacement therapy, supplements, and lifestyle modifications. With a background from Beth Israel Medical Center at Albert Einstein School of Medicine in New York, Dr. Kashyap brings years of experience and deep commitment to women's wellness. Fluent in Hindi, English, and Punjabi, she provides compassionate, comprehensive care to women of all walks of life. I can't wait to dive into her insights on hormone health, menopause, and how women can take proactive steps towards vibrant living. Let's welcome Dr. Deepali Kashyap. Hi, Dr. Kashyap.
Hello, Ginger.
How are you?
I'm very good. And how are you?
I'm good, and we are excited to have you on the show.
The feeling is mutual. I'm very excited to be here.
Yes, I think you're the first functional gynecologist that I've had on the show for sure, and I think you're one of few. I think you might be the only one in the state of Nevada that I'm aware of. So there's not a ton of functional gynecologists out there yet, but I know that you are really passionate about changing that and bringing that to other people. So we're going to dive right into it with the first question, which is, if you could tell us a little bit about your professional background and what led you to the world of functional or integrative medicine.
All right, sure. So I'm a board certified OBGYN, and I did my residency, as you mentioned, from Albert Einstein School of Medicine, and I have additional training in functional medicine from Institute of Functional Medicine and menopause management from Menopause Society. So as I was practicing early on, about 10 years ago, I realized that a traditional medicine is great, but it's focused more on treatment of diseases rather than creation of health. So that kind of led me into this journey and to delve into functional medicine, because what I focus right now on is to prioritize wellness, longevity, and not just treating the diseases.
Okay. And what inspired you to change how you practice medicine?
I think it was my own actually personal health. So again, going back 10 years when I was practicing OBGYN and as a young mother of two with traveling children, with traveling husband, what I realized was that I was getting through the day without proper nutrition, no exercise, nothing. And I was just constantly feeling very fatigued, had severe migraines, no libido, just, going through a lot. To the point that my neurologist actually said that you don't get migraines, you just live in constant state of migraine and you're just coming out of it once in a while. And at that moment, I realized that something really need to change. I did reach out to my own colleagues about what I was experiencing, and nobody could give me an answer. And that's when I felt that, okay, let me go back to my roots, which is like, okay, good nutrition, exercising, stress management, and how do we incorporate into my life so that I can feel better. And that's how it kind of started with me. And the more I became aware, and when I was listening to my patients, and I realized many women are going through the same thing. So that's how my journey started into functional medicine.
So it's definitely influenced the way your personal approach to health and wellness as well as your professional.
Absolutely. So whatever I learned when I found into functional medicine, I felt it was kind of a link between Ayurveda, like Eastern medicine, and also Western medicine, like traditional medicine that we learn. And the more I practice, I realize that both are equally important. They have their own place. Like if somebody is having a heart attack, we're not going to tell them, okay, go take ashwagandha, right? So a traditional training is amazing. We have amazing surgeries, medications to take care of acute health condition and diseases. But for chronic conditions and longevity, like 90% of the conditions we can treat with functional medicine.
Great. We love to hear that. Can you share a story about a patient whose life improved significantly using functional and integrative approaches?
Sure, there are so many, but the one which really stands out is Alex. So I saw her many years ago. As you know, I practice in Las Vegas. So many of the women that I see actually come from casino industry. So she was again a young woman in her early 40s, and she came to me because she was just chronically tired and just feeling low. And she had seen many doctors before seeing me, and everybody said, "You're depressed," and they gave her antidepressants. Now, was she depressed? Probably she was depressed. And but I felt antidepressant was not the answer. We really have to dig deeper to figure out what is the root cause of her feeling that low and fatigued at that young age. So after doing I did all the testing and really didn't stand out too much. So I started to dig deeper. And what I realized was that she was working a swing shift. A swing shift means her work started at 4 p.m. and would end up at midnight. So by the time she got home and went to bed, it was almost like 2 in the morning. So she had a hard time falling asleep. And by the time she would be deep in sleep, it was already time to wake up to get her kids ready to school. And then she would come home after dropping them, making breakfast, and try to sleep from 9 to 1 p.m. And it was hard with the noise and with the light to fall asleep. And again, by the time she fell asleep, it's time to wake up again to go to her work. And she was very sad going to work because she really didn't get to see her husband, her children. So as a result, again, at work with noise, smoky environment in the casino, hard to stay up. Then she was constantly drinking coffee, not eating good food. So she had fragmented poor sleep. She was not eating nutritious food, having a lot of junk food, a lot of coffee, and also feeling very isolated. And even over the weekends, what stood out was instead of being able to spend time with her family, she was just constantly catching up on the sleep and errands. So we started making small changes at a time. And then I told her, I said, I think it's your job, it's the work schedule which is really negatively impacting your health. And I kind of convinced her to talk to her manager and see if we can change her time from swing shift to the regular morning shift. It took some time, but eventually she was able to do that. And that made a huge change. She was able to go to her work at 8, come back at 4, then was able to spend time with her children, with her husband, was sleeping on time, waking up on time, started exercising, cooking food. And in 6 months, she was a completely different person without any
Oh,
medication. And that really, again, reiterated what I believed in that it's not always the pills. It's really we have to find the root cause and make changes in our lifestyle. I mean, sometimes we do need medications, we need surgeries, but really, so there are many women like Alex that I see who, if we just dig a little bit deeper, spend some time, we can figure out what is bothering them and maybe we can fix it.
and that's one of the benefits of functional medicine too, right? That you're actually part of your practice is actually spending time with patients, really understanding their lifestyle, not just here's a medication and out the door and next patient. You're really able to take the extra time that I think goes back to the old school way of being a doctor, which is really finding out the whole picture, the whole life story, right? Not just, what's the symptom and, here's a pill for it.
True, true. Like when I think about it, even in older times, you had this one small village and you had one doctor, and the doctor knew everyone. They knew what you do. They knew what you're eating. They knew your children. They know they knew everything. So they could tell you, okay, if you're feeling this, then this is probably the cause, and this is what you need to change. And over time, we have lost some of it. And I totally understand in current society, it's hard to do that. But still, I think we can find out, we can spare a little bit more time and get to know our patients a little bit better and listen to them. And they themselves can give us a lot of answers that we are, looking for.
Yeah, and I think gynecologists by nature, I can speak to that. They almost are in that primary care position where, a woman, we feel more comfortable talking to our gynecologist about everything, right? Even more so
True.
sometimes than our primary care. So you
True.
become kind
Yeah.
of the pseudo primary, if you will.
Yeah.
And I think, yes, like you said, there's always going to be a place for the specialist. But, I even have like Dr. Billstrom, who's a specialist in autoimmune disease who treats with functional medicine. But again, he's taking that extra time with the patients, to really learn about what's causing the autoimmune disease. So, okay. So next question is really about kind of the business, since, this podcast is really for physicians, to help other physicians that are thinking about getting into functional and integrative medicine as a practice. So I'm sure adopting this new approach brought challenges for you. What challenges did you run into and how did you navigate those?
Yeah. Change is always challenging. But sometimes status quo is not good too. Just the fact that you're thinking about changing already tells us that something is not working, right? So we have to decide, do we really stay stuck in this system which is ineffective and healthy, or do we really push forward, which is harder, uh, and create something better? So that's where the change really starts. When I started practicing, doing the functional medicine, there were challenges, and the challenges came from a lot of different perspectives. From patient's perspective itself, like I'll give you an example. Like a lot of time when patients come to me, because our society is like that, when we think of doctors, we think of healthcare, we feel we have to go to a doctor only when we are sick. So many women, it's changing now, but many women, when they came to me, it was only because they had a problem. Even Alex, that I mentioned earlier, she came to me not because she wanted to have a, you know, uh, she was looking at wellness or longevity. It's because she was really struggling, she was suffering. So patients have this idea that I'm going to the doctor because I'm sick, and they want a quick fix. They do want a prescription and medication, many of them. So it took some time for me to convince them, some less, some more, that yes, let's give you a pill, let's fix acutely what's going on, but let's really look at what is actually happening in your life and how can we create a better health. And many of time I did get questioned, like if you're asking me, what do I work? What is that supposed to do with me having headaches? Things like that. So that was the challenge now, because patients know I practice holistic care. So they are okay with me asking all sorts of questions. Second thing is our healthcare system. If you're practicing in a insurance-based system, it gets harder, because when you're practicing functional medicine or when you're really doing root cause medicine, just to be able to understand what is the root, you really have to spend a lot more time with the patients. And our current healthcare system, that can be challenging. The insurance companies, they do not reimburse for any functional medicine care. So that's another challenge too. So when I started practicing and I didn't know anything different, I had these two different kind of systems. Like patients were coming from for traditional medicine, which we were using insurance-based model, and then patients who were coming for functional medicine, we were using this cash-based practice. But as I started doing, I realized that it's not really working, because many of the women that I'm seeing in my traditional model really need this functional medicine approach. And and they probably need it more than people who are coming from functional medicine, because a person who is aware of functional medicine already knows a lot of things, is already incorporating these things, right?
Right.
They are looking for more advanced testing and for other things. But this person who is not aware of lifestyle things, this person actually needs this care more than that. So what do I do that? How do I bridge that gap? So that was the challenging part. So it took me few years to figure out what I want to do. And, thankfully that's what I'm doing right now.
So you're just a based model now?
No, so I actually do pretty much everything within the insurance based model. So
Okay.
what we do is, when I see a patient for any problems, like I'm a gynecologist and I'm a menopause specialist. So whether they're coming for perimenopause, menopausal symptom, or abnormal bleeding, pelvic pain, whatever problem they're coming to me with. So I do spend more time to get more information. And people who are receptive to this kind of care, I also have them see. I have a health coach in my office. So she also spends almost 45 minutes with them, getting a lot more information, which I would like to get. So she gets all that information, so which then we talk to each other, kind of that helps me to understand this person a little bit better. I've also created a lot more questionnaires which patients fill out, and we are able to go through them a little bit quickly again for me to have more information. Then I show my patients, depending on what they're experiencing, both kind of testing. I show them the routine testing, which we do, and also some of the functional medicine testing, which can be valuable for them. And because functional medicine testing, again, is not covered by insurance, it's more time consuming, energy consuming. So it's up to them. If they want to do it, then we do that. Some people who don't want to do it, then they don't do that. And I think by now, after doing so many years, I kind of work, this kind of work, kind of already knows, okay, what will work better for this person. So once we have all the information, whatever somebody test want to do, I start wherever the patient wants to start.
Okay.
So this is then the second testing part. Now, third, the treatment part. So my treatment now no longer just involves giving medications or saying, okay, this is the surgery you need, whether it is pelvic pain or bleeding or perimenopause. So again, we create a whole holistic plan where there is lifestyle intervention. Then I give them list of natural supplements. And again, I've created my own list, so it's easier for me to give it to them this will work. And then again, whatever medication or hormones they need, I tell them about that. And most of the time, it's very holistic approach, and people are able to do that. It takes us sometimes few more visits than it would have taken with the functional medicine, where they come and see me for an hour. But some with this model, they do come and see me 2 or 3 different times. But we are able to work within their insurance model and do everything holistically.
That's great. So you're basically, utilizing, because I know a lot of people want to be able to use their insurance. So you're allowing them to use their insurance. It does take a little longer. And you might make a little less than you would in your traditional practice if you were just because you are giving more time. But I think that's really great that you're offering that service. And then for the functional medicine testing and stuff like that, since that's not covered insurance, then do the patients just pay for that cash pay out of pocket?
Yes, they do pay
Okay.
cash pay for that. And they, a lot of times, Ginger, um, if they have to see a naturopath, and because they don't take insurance, or if they have to see a pure functional medicine practicing physician, the consultations are so expensive, like $500 or sometimes even more. A person who is not able to even afford a nutritious food, they're not able to do that or go to the gym. How do we expect them to pay that much for a consultation?
Right.
Even if they save money, they go for one consultation, they will not be able to go for follow-ups or everything. And many people are, some people are, they can afford it, they can do it, but majority of people are not able to get it done. So
I think that's so admirable of you that you're really taking a little bit of hit financially yourself, but you're really helping patients, especially patients that would not be able to afford this type of treatment otherwise. I think that's very kind of you.
yeah, I mean, I don't want to take a like high really moral ground or anything, but I mean, it just makes me really happy. So, ultimately, again, now I'm being philosophical here. Even if we want to make more money, why is that? Because it makes us happy, right?
Right.
Ultimately, the joy and satisfaction is what everyone's seeking for, right?
Right.
So it really gives me lot of joy. I cannot tell you how I feel when people like Alex, and I see that all day long in my office. The first time they come in, I have so much Kleenex, people are crying, and we do this, and they come back and they're feeling so good. Really, that makes me so happy. It is so fulfilling. So I don't even think I'm taking a hit or anything. It's like it's a blessing. It's wonderful.
And I think it's why a lot of doctors, went into medicine from the beginning. I mean, I've never met a doctor. There's probably a few that went into it for the money, but the majority of people went into it because they really want to help people and they really care. And so I think it's great that you're fulfilling, your role that you really dreamed about as a young woman. I'm sure going through the burden of medical school. Um, Next question is, what do you wish someone had told you when you first started practicing this way?
Honestly, I don't know if there was anything specific somebody would have told me. Because really, my journey kind of, if I look back, it really evolved step by step. When I first started, I just knew that, like you said, as a doctor, you want to do good work, you want to help people. That's the ultimate goal, or that's the spark in your heart. That's what you really want to do, right? So I knew that's what I wanted to do, and I was doing what I was, my medical school residency training taught me to do that. But somewhere I felt that something is missing, and that led me to here. And while doing it, I really didn't know what to do. So it was really a journey where everything I kind of, where I am, it just happened step by step. Uh, I had to put in thought and then what my patients told me. So I listened to them. The barriers came, the problems came, and together kind of navigated, because really there is no Google map or no blueprint of how to do it. And I
Right.
think it's different for everyone. Wherever you're practicing, you have different setbacks or different barriers, and what you want to do is different for different persons. So you kind of just see where you are, how you're going to do it. So I don't know if somebody could have told me how to do it or what I do.
So, what advice would you give to other MDs or DOs who are thinking about adopting this approach to medicine?
I think two most important questions, which I always ask myself, is what is it that you want to do, and why do you want to do this? And that's what I would tell everyone to, and this is, the answers are different and specific for everyone. Once you know the answers to these questions, then you have to see where you are practicing, what is your patient population, and what is it most of the people are looking for, and then what are your barriers practicing in that area. Whether you're in private practice, whether you're working for a corporation, you're working at a university center, are you seeing men, women, you're seeing working women, or you're seeing children? So, your patient population, what is it that they want, and how do you want to do it? So that those are the basic thing concepts that you want to understand. Then you can create. And also, a very important thing is true to yourself, understanding what your patients need. What is it that you lack in education? Like, I'm constantly learning, that I realize what my patients are asking me. If I don't know, then I go back, whether it is more certification or it is more degree or whatever it is need. Then I want to fill that gap in my own education and bridge that gap and do what my patients need and what makes me happy. And
Very
that's
good.
what I would tell everybody to do the same thing.
I love that. What trends in functional and integrative medicine are you most excited about? Some of the up and coming trends. What is exciting for you right now?
I think it's really exciting times. I think things are changing. A lot more people are more aware of personalized medicine. In my practice, like kind of, I say, okay, let's focus on six things. One is diet, like eating more nutritious home food, clean food, avoiding processed food. Then let's focus on good sleep, quality sleep, not the quantity of sleep. Then your movement. It doesn't have to be going to the gym, going dancing, walking, swimming, whatever you like. Looking at the relationship, avoiding toxic people and nurturing good relationship, stress management, and then also EDCs, which is like, avoiding endocrine disrupting chemicals, which are present in our pesticides, our food, chemicals, hair supplies, everything. So on all these six aspects, I think there are so many gadgets and things coming which people can use at home. So you don't even have to start by going to the doctor. You can do all these things at home. Like, people have these Apple watches which can give you so much information, your EKG, heart rate, how much
Yeah.
you're moving, the sleep gadgets for better sleep, the CGMs, your glucose monitoring. So many things. I think technology has made it easier for a person sitting at home to incorporate these things. Then sauna, like infrared saunas are available, which you can put in your backyard. So you can do sauna at home. You don't even have to go anywhere. So I think the labels hopefully are gonna get better, the food labels, and there are a lot more organic things available. So I think it's easier for people to make themselves aware with the new technology and with new gadgets, start making these things lifestyle changes. So I think that's very exciting. And even
That
more
is.
doctors are going into functional medicine and learning. So I think it's good.
If there's one message you want the listeners to take away about functional and integrative medicine, what would it be?
So I would say that it's not even, it should be way of life. It should not be looked at, okay, we're going to do this to prevent disease or something. It should just be your way of life, and they're very simple things you can do at your home by yourself. That is functional medicine. Like, for example, wake up before sunrise, have a sense of gratitude when you get in the morning, take a cold shower, million things, that small things you can do by yourself, which is basically practicing functional medicine, holistic medicine. It's basically just bringing intention to everyday life, to what you do, and just do that, and you're going to be healthy.
I love it. That's excellent. And what is the best way to reach you? I'm sure that some of our listeners might be either doctors that want to reach out to you and just, chat with you, or, women that might need your help. What's the best way for them to reach out to you?
I'm a little active on Instagram now. We have an account. It's under my name, Dr. Deepali Kashyap.
Okay.
So, and they can message me on that, and I try to be active on that little bit. So that's
That's
the best way to
great.
reach me.
Excellent. Well, I just want to say thank you so much for being on the show today. We really appreciate you taking time out of your busy day to be on the podcast.
Thank you, Ginger. It was my pleasure. Thank you for inviting me.